Hey guys, this is Dr. Hub. Today we're looking at the infertility treatment procedure and their indications. So in terms of the indications for the artificial insemination with the husband's semen. So in terms of the AI, that is artificial insemination with the husband's semen. So what are the conditions? There is in terms of the chronic medical condition or the disorder. Then in terms of the oligospermia, and this is after the sperm washout. Oligospermia after the sperm washout. Next is in terms of the impotency. So there is impotency or the ejaculatory failure. So in terms of the impotency or the ejaculatory failure. Next in line, there is the premature ejaculation in terms of the premature ejaculation or the retrograde ejaculation. And in terms of the hypospadiasis. Then there is also the anti-sperm antibodies, and this is in the cervical mucus, and in terms of the unexplained infertility, then there is also use of the frozen sperm. So what is the frozen sperm? It is if the husband needs to undergo the radiotherapy, chemotherapy, or is unavailable at the time. So if the patient is unavailable or he undergoes the radiotherapy or the chemotherapy. So CT here is the chemotherapy. Next is in terms of the X and Y fractionation, and this is for the sperms for the sex selection, and this is for the sperms, and this will be for the sex selection, and this is in a genetic and a chromosomal abnormality. In terms of the genetic and the chromosomal abnormality. Next is in cases of the HIV positive female and male. So HIV positive female and the male. Now we move on to the indications for the intracytoplasmic sperm injection. So what is the indication in terms of ICSI? ICSI, let's write the full form. It stands for the intracytoplasmic. So intracytoplasmic sperm injection. There is sperm injection. Then comes the gift. So where do we apply gift? So the full form of gift is very important. It stands for the gamete intra-fallopian transfer. So the gamete intra-fallopian transfer. So these are done in case the sperm count, it turns out to be less than 5 million per ml. So in terms the sperm count, it turns out less than 5 million per ml. Next is in terms of the absent. In terms of absent or the reduced sperm motility. Then comes the abnormal sperm morphology. In terms of the abnormal sperm morphology, and in case of the previous failed IVF, there is failure of the IVF, and in terms of the failure to penetrate the zona, failure to penetrate the zona, and this is by the sperm as seen in the IVF.